Adalimumab, also known as Idacio, cf. 40 mg per 0.8 ml subcutaneous syringe kit, is used to reduce pain and swelling in certain types of arthritis, such as rheumatoid, psoriatic, and juvenile idiopathic arthritis. It is also used to treat certain skin disorders, like plaque-type psoriasis and hidradenitis suppurativa. This medication works by blocking a protein called tumor necrosis factor, TNF, in the body's immune system, which causes joint swelling and damage in arthritis, as well as red scaly patches in psoriasis. By reducing joint swelling, Idacio, cf. 40 mg per 0.8 ml subcutaneous syringe kit helps to reduce further joint damage and preserve joint function. It is also used to treat certain bowel conditions, such as Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. If you are prescribed this medication, it's important to follow your doctor's instructions on the daily dosage and the optimal timing for taking it. Before you start using Idacio, cf. 40 mg per 0.8 ml subcutaneous syringe kit inflammatory bowel agents, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional and the product package. Before using, visually check the product for particles or discoloration. If you see either of these, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating it in the microwave or placing it in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule or a higher dose at the start of your treatment. Carefully follow your doctor's instructions for using this medication. Remember to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Make sure to tell your doctor if your condition lasts or gets worse. Some common side effects at the injection site may include redness, itching, pain, or swelling. If these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using Idacio do not experience serious side effects. However, it's crucial to inform your doctor if you develop signs of infection or experience any serious side effects. This may include symptoms such as new or worsening symptoms of heart failure, blood in the stools, mental/mood changes, numbness or tingling, and vision changes. Additionally, Adalimumab may rarely cause serious liver disease in people exposed to hepatitis B virus, so be sure to get medical help right away if you notice any symptoms of liver damage. It's important to note that this is not a complete list of possible side effects, so always consult your doctor or pharmacist if you have any concerns. When taking Idacio, it's important to be aware that it can weaken your immune system, making it harder for your body to fight infections. This can increase your risk of getting serious infections, including fungal and bacterial infections like tuberculosis. Make sure to inform your doctor about any past, recent, or current infections, and also let them know if you have lived or traveled in areas where certain fungal infections are common. It's crucial to be aware of any signs of infection and to seek medical attention if you notice any. Your doctor will also test you for tuberculosis before and during your treatment with Idacio. If you are diagnosed with TB, your doctor will provide treatment for it before you start using Idacio to prevent a serious TB infection while on this medication. There is a very small risk, especially in children, teens, and young adults, of developing cancer due to Idacio or your medical condition. It's essential to have a discussion with your doctor about the risks and benefits of the treatment. If you experience symptoms such as persistent fever, unusual lumps, swollen glands, unexplained weight loss, or night sweats, make sure to inform your doctor right away. Before using Idacio, make sure to inform your doctor or pharmacist of any allergies you may have, as well as any other medications you are taking. It's important to discuss your medical history, especially if you have had any recent infections, blood or bone marrow problems, seizures, nerve disorders, cancer, heart disease, or lupus. It's important to be cautious while using Idacio, as it can increase your risk of getting infections or make current infections worse. Avoid contact with people who have contagious illnesses and be sure to talk to your doctor if you have been exposed to an infection. It's also important to inform your healthcare professional if you are using Idacio before getting any immunizations or vaccinations, and to avoid contact with people who have recently received live vaccines. To reduce your risk of injury, be cautious with sharp objects and avoid activities that may result in injury, such as contact sports. Before undergoing any surgery, be sure to inform your doctor or dentist of all the medications you are taking. If you are an older adult, you may be at a higher risk for infections and cancer while using Idacio. If you are pregnant, discuss the risks and benefits of using Idacio with your doctor, and if you are breastfeeding, consult your doctor before continuing to breastfeed while using this medication. When taking Idacio, cf. 40 mg per 0.8 ml subcutaneous syringe kit, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk for serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Idacio, cf. 40 mg per 0.8 ml subcutaneous syringe kit include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Be sure to discuss any concerns about potential drug interactions with your healthcare provider. If you or someone you know has taken too much Idacio, cf., and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center for assistance. It's important not to share this medication with others. You may need to undergo lab and/or medical tests, such as complete blood count and liver function tests, while using this medication. It's important to keep all of your medical and lab appointments. Make sure to consult your doctor for more details. If you forget to take a dose, talk to your doctor or pharmacist to get a new dosing schedule. Do not take a double dose to make up for the missed one. It is important to store Idacio, cf. 40 mg per 0.8 ml subcutaneous syringe kit in the refrigerator, but do not freeze it. Some brands of this medication may be stored at room temperature, so it's best to ask your pharmacist or read the product package to see if that applies to your medication and for how long. Once it has been stored at room temperature, it should not be put back in the refrigerator. Keep the medication in the original container to protect it from light, and discard any unused portion. It's important to keep all medications away from children and pets, and do not flush them down the toilet or pour them into a drain unless instructed to do so. Make sure to properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.